AIDS and other diseases, it's because we always see it as an illness. So meaning, for example, this COVID-19, sometimes we are just seeing it, COVID positive ka. That's uh, that's the positive thing that is negative, ano, when you are positive with COVID-19. So we are not looking into the other aspect. So minsan, enough na ba pag nag-prescribe ako ng azithromycin, pero hindi naman siya makalabas or feeling niya nakapreso siya. So these are the things that we have to look into when you are in a public health, no? So parang public health is there is a clinical side, no, of those diseases of public health importance. Okay. So if we want to have an optimum or optimal medical practice, we have to be person-centered, health-oriented, and community-based. No? So, tao rin yan. Hindi yung, minsan dumadating pa lang, I remember na pag mga RHO kayo, dumadating pa lang yung pasyente, meron ka ng prescription. No? Dumadating pa lang yung pasyente, ay nako, TB ito. No? Tinignan mo pala itsura, inistigmatize mo na, no, tibihon ito. Or ito, tignan mo, pagkita mo, ay nako, watihon. Okay, so minsan na ano na talaga tayo na we already have our, hindi pa natin nakausap yung pasyente, we already have the diagnosis, no? Especially pagdating sa ADEPT, yung adolescent youth na i-discuss din natin in some time. Tatapusin natin lahat yung essential healthcare packages. So it has to be person-centered, health-oriented, and community-based. So when we say biopsychosocial model, it emphasizes the unity of and you remember this, why we keep on treating the reason why they are ill. Reseta tayo ng reseta, balik-balik na lang. Amoxicillin, cotrimoxazole, 'di ba? Sa mga sa mga huron-huron or even in the health center. Pero hindi naman na-address yung congestion. Hindi naman na-address yung smoker sa bahay. Hindi naman na-address na yung pala ang ginagamit nila sa kalan ay hindi katulad ng ginagamit nyo na naka-microwave. Sila ay itong uling, kahoy pa. So syempre yung bata, no, na-expose siya dun sa usok, so kaya palagi siyang may ubo. Okay? Or hindi naman like yesterday, someone asked me for the other day, someone is asking me for what do you call this? Asking me for PWD card. So may bipolar siya. Okay? Dahil bipolar, syempre, what kind of disability is this? Is it physical disability? Is it a psychosocial disability? Is it a mental disability? Is it other learning disability? Ganun lang ilalagay mo. So nilagay ko siya na mental disability. Nagreklamo yung father na, wag mo na lang kung nailagay na mental disability. But we know that bipolar is a mental disability. Kailangan ma-reach doon sa acceptance nila na it is an illness. However, there are other aspects of bipolar that you can mainstream already the patient. So, hindi mo siya tinatago na sa box, di ba? Hindi mo na tinatago sa box yung mga mental disabilities. Or, not only on the social, but also a socio-economic context, no? I remember I joined a medical mission in, I think, where is it? Bicol, I think Bicol, or I forgot. Pero, ang dami talaga dong yung lahat ng mga bata, ubo ng ubo, ubo ng ubo. Alam mo, I have a friend na, American, di talaga sila nagbibigay ng cough syrup. Alam mo kung anong binibigay nila? They just give deworming tablets. Because deworming tablets, di ba? Malaki yung burden ng ng ascaris. It can lodge in your lungs that makes you cough, no? Kaya kung malnut or isa sa binago ko sa City Health Office is the deworming. Talagang alam mo, kumonti talaga yung nagko-complain ng cough and cold sa mga medical mission kasi regular naming pinupurga. Okay? So ano yung ating pagpurga? Today, January is deworming month. Okay? So paki-note na lang, if it's a deworming month, okay, it's for kinder to grade 6, ha? Round 2 na yan. Pag January, it's already round 2. From kinder to grade 6. And then, 1 to 4 years old and 13 to 65. Kaya, sa mga nag-a-apply ng licensing sa amin, sa mga health card, hindi na ako nagpapa-stool exam. Why? Number 1, because of this psychosocial model. Number 1, hindi naman totoong oo yung binibigay. Minsan, cake. Imagine, nagsasabit ng cake ang mga medtech dito. Will you know na yan ay cake? Di ba? Or, bumibili ng mga na klase ng cake. Ano ba yan na flavor na parang kulay oo? No? Or, kung 20 sila, isa lang oo, tapos yung tawag dyan, yung kanilang, yung accountant, i-divide lahat yung oo ng isa sa 20 para pag yun na lang ibibigay. Malalaman mo naman. So that is how kaya nga ang laki-laki ng challenge ng public health. So I changed it. Sabi ko, okay, wala nang stool exam, wag na kayo mag-submit, namamaho lang ang City Health Office. Deworm kayo. Because yun naman yung reason ba't kayo dine-deworm, especially sa mga food handlers. Okay? So, 1 to 4 years old and 13 to 65, and then yung kanina, yung kinder up to, kinder up to grade 6, no? Why? Why? Why we have to do the deworming? It is every January and July, no? Every January and July, you do the deworming. Okay? And the goal is to decrease the, what? Incidence or prevalence? The prevalence of worm burden, no? That is related to what? Weakness, tapos yung low IQ. Do you know, pag ikaw ay mataas ang worm burden mo, bumababa din yung IQ mo. And then, wala ka rin ganang kumain. And of course, yung anemia, no? Iron deficiency anemia, secondary to the parasites. Okay? And, of course, when you do the deworming, you have to make sure na the child is may nakain. Hindi pwede na ang bata ay hindi nakakain. Okay? So what are some of the side effects, no? Na pag binigyan ka ng albendazole, we are using the albendazole, no? Sometimes they will have stomach pain, sometimes sumusuka, sometimes nahihilo, or yung iba nagtatae, no? But it's only temporary, okay? Pero pag problema is pag mataas na yung worm burden, lahat ng opening. Nakakita na ba kayo na mga bulate lumalabas sa bibig, sa ilong, at saka sa tenga? Have you seen that? Were you able to witness that? Hello? Were you able to witness that? Diba? I was in Hinunangan. Sorry sa mga taga-Hinunangan, hindi ko naman sinabing ano. So, when we had the medical mission in Hinunangan, sabi yung nasaan talaga. So, we had a medical mission, and then ang nangyari, so, sumuka sa akin yung bata, 2 bata. Pagsuka ng bata, mga ascaris yung sinuka. Tapos tinuka naman ng manok, yung mga ascaris. Tapos yung ulam namin kinagabihan, tinolang manok. Parang ayaw ko nang kumain. So yung feeling na ganun. And yung kailangan mawala talaga yung worm burden kasi ang laki-laki. And also sa anatomy nyo, I don't know, wala kasi kayong mga, meron pa sa anatomy cadaver namin. Akala namin kung anong object yun, yung pala ay worm bolus, no? Na naging, na it can stuck in your sa lungs or even sa intestine, no? Dahil sa dami ng bulate. So dapat wala na tayo sa na ba ngayon, internet age na tayo, dapat wala nang may bulate, pero meron pa rin. Kaya kayo, kahit medical students kayo at malalaki na kayo, you still have to deworm. So, the scope of the biopsychosocial model is of course, there is sickness and there is wellness. Okay? Why they are sick, which ways the patient is sick. So you are going to develop a rational program to treat illness and restore and maintain health. So you are looking into the illness conditions, the pathophysiology. You are looking into the problems of living, kung ano yung kanilang tinitirhan, and emotional reactions to life and circumstances. Katulad ngayon na nga, na hindi na lang nagpapa-check up, kaya ang daming namamatay. Pagdating sa mataas yung death kasi kung kailan natatakot magpa-swab. Kasi magkano ang swab? 5,000. And of course, somatic symptoms. So there are some illness brought by somatic symptoms. Okay? Bakit ka ang sakit-sakit ng ulo? Yun naman pala hindi niya alam ay siya pala ay dehydrated lang. Okay? So, you're going to narrow the disease orientation and widen your perspective on the social orientation. So, from the disease organ, you are going to look into the impact of illness, why they are sick. Okay? So, in this slides, you can see the biopsychosocial factors in health. No? Sa psychological behavioral factors, is a check nyo kayo. Are you stressed? Yeah. Check. Okay? Coping tactics, no? Na pinalaki kayo na ganun. And then, so, both of these, the physical health and illness, are brought about psychological, biological, and social. So, stress for the behavioral, stress, coping tactics, personality, health-related habits, and reactions to illness. Pagdating naman sa biological, na yun lang mismo ang tinitingnan ng mga clinician, the infectious agents, the environmental toxin, genetic predisposition, physiological reactivity, and immune response. Pagdating sa social system factors, you have to look into the social support, health education, pollution control, sanitation, and medical care. So ito yung nandun naman doon sa tinatawag natin na service delivery. Okay? So the biopsychosocial model is a scientific model constructed to take into account the missing dimensions of the biomedical model. So enables the physician to extend application of the scientific methods to aspects of everyday practice and patient care. So it is a whole person approach. Holistic yung approach mo. Hindi mo lang tinitignan yung COVID-19, but tinitignan mo rin, okay, bakit madami gusto sa home na lang? Ha? Kasi ayaw nila sa ibang mga sa ibang area. Common yung CR, 15 kayo sa isang room, no? So nawawala yung privacy, natatakot ka na mawalan ka ng everything, no? So yun yung consideration. Okay? So Engel, in one of the hierarchy of the natural system, the clinical application of the biopsychosocial model, this is sinasabi na dito sa side, no? Parang ano siya from your person, no, pataas and then pababa, no? Sa person, you have your system, your nervous system, organ system, tissue, cells, organelles, molecules, atoms, subatomic particles. So for the person yan, alam niyo yan kasi you have embryology and biochemistry, everything, no? Doon naman sa pataas, going to the biosphere, meron kayong person, but at the same time, meron ding yung person itself, the two person, kung meron kang involved, kasi talagang no man is an island, and then the family, the community, the culture, subculture, society, nation, and then the biosphere. So to further emphasize that single individual, no, or the person is the highest level of organismic hierarchy and at the same time the lowest unit of social hierarchy. So meron sa individual, meron din sa social. So tayo hanggang dun lang tayo tumitingin sa biological, pero hindi natin tinitignan yung social aspect of psychosocial aspect ng tao. Okay? Sample. Can someone read this? Any volunteer?
Mr. Bieber, J. Bieber, 6 years old, married, retired clerk. Chief complaint, right-sided weakness. History, A few hours prior to consult, patient was noted by his friends to be sick. He does not want to talk. Upon further questioning with a friend, he pointed to his right hand and foot. He has difficulty moving it. However, with a slurred speech that this could be due to fatigue only, his friend prodded him to seek consult. Past medical history: 2000 HPN, highest BP
Year 2000.
200. Highest BP is 200 over 100, usual 140 over 90. Took nifedipine as needed. Pertinent PE, awake but aphasic. BP 180,
Aphasic,
BP
yeah.
Basic.
180 over 100, limited range of motion in extremities.
Okay. So, a retired clerk, 62 years old, complaining of a right side. Thank you, Argil. Right-sided weakness. Okay, the cause is Mr. J.B. Burr was admitted for 2 weeks with a diagnosis of cerebrovascular disease, left middle cerebral artery occlusion, and hypertension stage 3. He has lost functional capacity and ability to communicate needs and emotions. He was treated accordingly and rehabilitation was started in the hospital. So that's the course of Mr. J. Bieber. So how are we going to apply the biopsychosocial model? Okay. So of course, you will start with the two-person system, the doctor and the patient. Okay. For the inner experience, syempre, ano siya, siguro mag-aalala siya sa yung feelings, the feelings, the sensation, the thoughts, the opinion, and the memories, and then the observable behavior na nakikita ng doctor. Okay? Clinical approach of the physician is influenced by the system perspective of the biopsychosocial model. Now, the doctor or the physicians consider all information in terms of continuum of system and its correlation with the sequence of events in the patient's illness. So, J.B. Burr, his friend, no, recognized that the patient looked sick, reported his observation to the doctor, and persuaded the patient to go to the hospital. The socio-demographic profile is, of course, age. He's 62, gender, male, place of residence, marital and family status, occupation, indicates system characteristics that is useful for future decision making. And also, towards the course, no, JB refused to acknowledge illness and hard to be persuaded to seek medical attention. Maraming ganyan, no? So there is a psychological state and conflicts kay JB. So therefore, a good interpersonal relationship is needed to explore psychosocial issues. Kaya kailangan talaga you develop trust, empathy to the patient. So we will look now with the individual, with the illness, and the family dynamics. Okay. So from the two-person, now the family. So in Roland's psychosocial typology, you get to look on the illness, the cause, and the outcome. Okay. So the illness is hypertension, stroke, and then the course start for a 2 weeks rehab, and then what will be the outcome. So for the illness, you are going to classify it, is it acute or chronic? So in the case of J.B. Burr, it's what? Acute or chronic? Hello? Is the illness acute or chronic?
Chronic, Doc.
Chronic po.
Okay, very good. It's chronic. What is the course? Progressive, constant, relapsing.
Progressive, Doc.
Progressive po, Doc.
Okay. Good, very good. What is the outcome? Incapacitating and capacitating.
Incapacitating.
Incapacitating. So ngayon titignan mo na siya na nakakita ka o meron kayong kamag-anak na nag-COVID-19. So the illness is acute. Okay? The course is, it can be progressive kasi 14 days. The outcome is what? Capacitating also. So, ganun yung pagtingin natin. Tingnan natin, what is this illness? HIV/AIDS. So, usually, HIV, when it's already AIDS, is already chronic. The course is progressive, and the outcome can be with medicine, with proper antiretroviral drugs, it is capacitating. Okay. So, acute illness is a potential for crisis, especially when family routine are suspended. Emotions are high, especially if the family perceives that the care given by the physician is not satisfactory. Diba? Kaya marami nagdo-doctor's hopping. And then the suddenness of illness find it difficult to face the stress. You as a physician can help facilitate response or acceptance of diagnosis and recognize danger signals such as delayed or prolonged reaction. Okay. For example, marami kaming ganito, nag-positive. Lahat sila, gusto nila sa hotel. Eh, naman pwede lagay namin sila lahat sa hotel, no? Kasi daw, yung perception nila, pag dun sa, what to call this? Excuse me. So, emotions are high, no? Kasi bago nga ito, hindi pa natin alam tong COVID-19. So, hindi nila alam kung paano and ano. So, ako as far as even specialists are calling me. And then, suddenness of illness. Alam naman natin, COVID-19, pag ikaw magka-COVID, talagang napaka difficult, no? So, me, for example, as a physician, can help facilitate response. Naku, lalo na, we have positive na doses sila sa family, tapos mga big time pa na mga family. Medyo nahirapan ako, no? And yet, I told them, ito yung mga, inisa-isa ko. Ito siya is 62 years old with hypertension. So, kailangan talaga, yung isa buntis, yung isa ang taba-taba. So, mga ganun ba? These are things that you have to look into when it's an acute illness. Again, illness, and then, ano yung pangalawa? Course, and then outcome. ICO, illness, course, and outcome. So, for chronic illness, prolonged fear and anxiety and higher incidence of illness in other members of the family. Karamihan dito sa mga chronic illness are what? Itong mga lifestyle-related non-communicable diseases, LRNCD. And of course, yung mga matagal na gamutan. Aside from cancer kasi it's considered LRC and NCD, yung mga TB. Okay, of course, yung yun nga, yung HIV, kung may HIV/AIDS sa family. And then, additional burden, there's a feeling of guilt, angerness, and resentment towards the sick member. Di ba, minsan, tigas-tigas ulo, yung nag-stroke, no? Hindi na makatayo, ikaw mag-aalaga ka, palitan kayo ng pag-aalaga. No? So the physician can encourage ventilation of feeling and give reassurance and reinforcement for care. Okay. Kaya dapat tayo, we also have a portion of compassion and empathy as a doctor. You can tell them to ventilate their feeling. Pero ngayon, I will stop share for a while. Di ba ngayon, halos ang doktor, matagal na yung 5 minutes sa pagra-rounds. Things have changed, parang more than matagal na yung 5 minutes. Minsan hindi mo pa nakikita yung doktor, ang laki na nang na-charge. Is it true or not?
True.
True or false? Di ba? So, kaya nga, ang hirap makahanap talaga ng doktor whom you can talk to. Karamihan pa naman ng mga may sakit or even the family members, they want doctor that they can talk to. No? And mostly, pag na-admit na, talagang minsan matagal na yung 5 minutes. No? Tapos hintay kayo ng hintay. That also on the agony. Okay? Tapos, hindi mo pa matawagan, hindi mo pa ma-text, hindi pa pag sinasabi mo sa resident or sa intern, kakaproblema. Those are the things that really affect the illness, no? Lalo na pag nakita mo, ano ba talaga ito, doc, no? Hindi dapat ma-explain. So, ang nangyayari, nag-i-increase tuloy yung ano mo, yung anxiety. So, of course, pag terminal illness, just cancer, it is a potentially devastating emotion, especially disclosure, paano mo sasabihin na actually, I think how many medical students that we have certain medical students that are HIV positive, no? And yet they can streamline as long as they have their medicine, no? Antiretroviral drugs. So siguro pag malaman mo yon na positive ka, it's really devastating, no? Cancer is also devastating. Lalo na hindi ka nagpapa-check up. I have a friend, nag-COVID siya. After nung mag-COVID, parang naging naging uncomfortable yung feeling niya. So pumunta siya sa Cebu. It was very shocking. It's colon cancer stage 3 already, no? So it's overwhelming anxiety, you will go through a denial and disbelief. Bakit ako? Bakit meron akong ganito? So the physician can assist the patient and family in relating to healthcare system. So meron po tayong you can say we have yung mga alternative or palliative, no? And then you can aid the patient and his family in efficient and functional readjustment. Yung iba nag-stop magpumasok, no? Or yung iba mag-aral, and then ito tapos yung saan mo kukunin yung daily sustenance, okay? And of course, you provide quality care. Again, home care for the Filipinos is the best and most accepted, but not in America and other areas, okay? So the psychosocial time phases of illness is we have 3, the crisis phase, the chronic phase, and the terminal phase. So sa crisis phase, there are asymptomatic period prior to diagnosis. Pero meron ka nang nararamdaman, di ba? No? Or, nararamdaman. It's parang pre-pathogenesis, no? So initial readjustment and coping takes place. Okay? Chronic phase is the time span between initial diagnosis and readjustment period. Can either be short-term or long-term, and the response of patient and family will depend on the category of illness. Iba kasi pag infectious, iba naman pag long-term, iba rin pag cancer, no? And terminal phase, inability of death becomes apparent. There is possible loss, grief, and mourning may occur. I just want to know who had experienced death in the family that is bigla, yung all of a sudden or accident, bigla na lang, hindi mo expected, namatay na. Can you put what? Ano ba ito na open mouth? Sige, open mouth. Yung merong biglang namatay sa family na hindi mo inaasahan. Wala? Wala. Okay. Isa lang? Isa lang? Isa lang ang may namatayan ng bigla sa family?
I think so, Doc.
Okay. So, where is she? Saan na ba si ano? O, sino naman yung a thumbs up naman, yung nagko-cope up because someone in the family has a terminal illness? Thumbs up. Okay. Isa lang din? Dalawa. Oh, very good. 2 lang. Okay. Kasi iba-iba yung response natin sa family. I have experienced both. I have experienced both yung merong bigla, no? My husband passed away. I just talking to him at 9 o'clock. By 12 o'clock, he's gone. And my father naman had, my dad has cancer of the brain. So, napagdaanan ko yung pareho. Pero magkaibang, yung sa dad ko, I'm still young, that time, high school. And yung effect sa akin is that parang iba kasi we're 9 in the family. Tapos lahat na nung ari-arian namin during the 70s, nabenta na namin para lang idugtungan yung buhay niya, everything. Pero still, no? And that really taught me a very hard time in my in my life. I have to work at a very young age so I can study. No? Ang hirap-hirap nung pinagdadaanan ko, nagbebenta ako, even medical student, lahat nagtuturo ako while studying and all these things. So yun yung pinagdaanan ko. Pero naman yung sa husband ko naman, iba rin yung response, no? Kasi it is unexpected, no? And yet parang meron lang nagganyan sa heart ko. I was ano to? Parang pakiramdam ko, gumuho talaga yung mundo ko. And parang sabi ko, Lord, I don't understand things, no? So hindi ko alam how will I react at that time. And another is also when I gave birth to my son, no? Hindi pa ako dapat nanganak ako, and he had sepsis, no? And yung kanyang parang nagbi-bleed pa ako. I have to stand kasi kailangan alagaan ko siya. And we stayed in the hospital for 12 days, more plus 12 days. So January 4 plus 16 and And then that time no one wants me to take the board exam. So kapapanganak ko pa lang January 4, nag-exam ako February 4. Sabi nila nagsusuicide ka ba? No? That was my response. So lahat ng mga pinagdaanan ko lumabas sa exam, no? Yung sa pedia, yung sepsis of the newborn. And then at 4 years of age, he had Kawasaki disease. So grabe, iba-iba yung response ko dun sa mga sakit na pinagdaanan. And ang problema dun sa anak ko, 21 days of fever. Normal lahat. Normal lahat ang mga, di ba? Anong magiging response mo nun? Kung yung mahal mo sa buhay, tas normal lahat ang resulta. Nagtataka ka ba't ganun? Sira ba yung thermometer? 44 yung temperature. And your only son, hindi ka na nakikilala. So how would you respond? Oh, tapos nag-IVIG siya. Nagkaroon siya ng reaction sa IVIG. Sumuka siya ng literally a liter of blood. A liter of blood at 4 years old. Sumuka siya. So, I think my son is really a miracle baby. Na sa lahat ng pinagdaanan niya. So, sa lahat ng pagdadaanan natin, kaya siguro na-develop din sa akin yung psychosocial response sa mga taong may sakit. Because you can really sympathize, empathize with them. No? And he's a miracle baby. So, iba-iba yung I have the mourning and the grieving process is different with my dad, with my mom, and with my husband, and with my sisters and brother. Merong denial eh. In fact, nung namatay yung sister ko, I'm here, no? I'm the only one here. Namatay yung sister time ng COVID, pero wala siyang COVID. It was May, Mother's Day. Mother's Day ba May Tapos ang problema, ang tagal-tagal niya dun sa waiting, hindi siya makapasok ng MCU hospital kasi nga COVID. So hanggang namatay na lang siya dun sa 10th hospital. Hindi na siya ma-CPR and galing siya ng Divisor, so hot during that time. So yung mga ganun. So marami kang misgivings sa health system, marami kang misgivings sa doctor. Yung inis na inis ka doon sa mga ganon. But thank God, kung meron kang support system sa family, mas mabilis ka maka-cope up sa sa grief, mas mabilis kang makakrop sa denial. So, this is the, okay. The problem is, J. Bieber is vascular occlusion of the middle cerebral artery. Diba? BMCA. That's event 1. Okay? Ito yung system hierarchy on the left side. Again, from the person to the nervous system, organ system, tissue cell, hanggang molecule. At doon din naman sa taas, to person, family, and community. Okay? So, kung titignan natin, mag-start tayo dito sa person. Okay? Meron siyang problema na aphasia, right-sided weakness, difficulty ambulating and expressing needs, emotions, and thoughts. Okay? Clinically, meron siyang thrombotic occlusion of the left middle cerebral artery, decreases anastomotic capacity due to atherosclerosis leading to infarct. Sa organ system, there is occlusion of the artery leading to decreased blood supply to organs. Sa tissue, merong local destruction of tissue. Pagdating naman sa cell, affected neurons develop eosinophilic cytoplasm and small pycnotic nucleus. And then molecule nerve cells die and disappear and replaced by fibrillary gliosis. So, clinically, yun yung nakikita natin. From the CT scan hanggang sa, or even CAT scan or MRI, hanggang dun sa nakikita clinically and also diagnostically. Okay. Pagdating mo naman doon sa two-person, yung between the physician and the patient, the family, and the community. So, nakita natin meron naman siyang help and support system given by the friends. Okay. Event 2, aside from the event 1 is the occlusion, no? Pagdating sa event 2, loss of ability to ambulate and communicate. Okay. Tignan naman natin dun again sa medical side, no? Bioside. So, as a person, meron siyang possible anger, frustration, difficulty ambulating, expressing needs, emotions, and thoughts. Okay? Sa nervous system, again, there is a loss of neurons supporting the muscular system, formation of scar tissue. Sa organ, there is loss of muscle mass. Sa tissue, there is ischemic damage to muscle tissue. Sa cell, there is ischemic cell change. Kikita mo, pag nakita mo yung CAT scan or MRI, no? Sa molecule, nerve cells die and disappear and replaced by fibrillary gliosis. Pero pagdating mo doon sa psychosocial is that sa two-person this time between husband and wife, no? The total dependency on wife. Kasi ano ka na, na-stroke ka na, and loss of capacity to ambulate and even to relate with family members. Sa family, nagkakaroon ng altered roles of family members. And magkakaroon ng reassignment of tasks, financial and emotional burden. Which is true, lalo na kasi nga stroke patient siya. And then for the community, there should be mobilization of rehabilitation services and help of neighbors and friends. So, nakikita na natin ngayon yung management ng isang pasyente na nag-stroke, no? And ito yung mga events na nangyari sa kanyang buhay. Event 3 is of course the recovery phase. Okay? Sa person, palaging nasa top yung person. So, became asymptomatic because of the rehab. No? There is improved self-awareness and actualization. A nervous system, anticipation of new role, organ system, no? Restoration of normal function, tissue, restoration of normal neural function, and the cell is restoration of steady state. Pero pagdating mo na naman sa psychosocial, ganun. Two-person nagkakaroon na ng trust and confidence to the wife or even to the doctor. Family, nagkaroon na ng realignment and nakapag-adjust na sila sa role. And then sa community, there is a support of medical team and social support. Pag halimbawa, kaya may mga community-based rehab. Hello?
Good afternoon.
Yeah.
Si Sir, kaibigan
Ah?
sa Manila ba?
Oh.
Yung tanay niya, andyan sa ano, tsaka yung tatay niya nasa Ace Hospital.
Oh.
Yung
Apelido?
yung hospital lang, Gabon ang apelido. Si Dr.
Oh.
Rosetta.
Oo.
Yung ngayon, itong si
Yung kapatid at saka yung asawa papunta.
saan?
Dito.
Oo nga.
Oo.
Bigyan mo pinapaano na ni Sir kung mabigyan ng endorsement kasi ang plano niya, yung babae lang naman, yung anak lang naman ang gusto. Papasok na siya naka-PPE tapos magka-quarantine siya sa hotel.
Ay, hindi. Okay na yun na pinaward ko na kay ano. Kasi una, nagbigay kami, hindi siya natuloy.
Okay.
Oo. Hindi siya natuloy. Nagbigay na kami ng letter of acceptance before hindi siya natuloy. Si Jay Santillan.
Santillan.
Oo, kilala ko. Nag-usap na kami, no problem na. Pinalab ko lang kay ano.
Hindi, okay na yung ano niya. Hindi yung sa ano, problema niya sa ospital kasi gusto niyang makausap talaga yung mama niya para mabigyan ng bus.
Oo, walang problema. Yung makakapasok naman siya eh.
Magpipigil.
Oo, walang problema yun. Pagdating niya, oo.
Bisita-bisita lang siya doon. Pero hindi siya lalabas sa pides lang, hospital lang yun sa kanya. Kasi dalawa yung katulong nila doon eh. Di ba dalawa yung kwarto nila doon?
Saan?
Sa Ace. Dalawa eh. Di ba yung sa tatay niya, iba yung sa nanay niya. Doon ang bantay na doon. So, siya lang, yung babae lang siya. Santilla. Okay, ano mo na lang sa hospital na gano'n.
Ay,
endorsement kay Mayor pa eh. Sabi ni Mayor, kung sabi mo, Dr. Aglo.
hindi na kailangan. Pero sa Sunday pa naman siya darating eh. Pag nakarating na, oo.
Sige. Okay. Sige, Doc. Thank you.
Okay. Let's try this. Paano ba yan? Dr. Belicano, nakakapag-groupings ba? Hindi. Sorry. Or assignment na lang ito. Anyway, naka-ano to, no? Naka-record, Dr. Belicano?
Yes po.
Okay. So, meron siyang a 50-year-old farmer complaining of hemoptysis is subsequently diagnosed to have pulmonary tuberculosis. He has to take the anti-cox medication for 6 months. However, he cannot afford to buy medicines. He is the breadwinner of a family of 6. Do you want this group or individual? You are going to analyze the intrasystem changes in this family using the biopsychosocial approach and construct the algorithm following the continuum of system. So the person, yung farmer. So ilang event ito? Pwedeng 2 or 3. No? Event 1 is the pulmonary tuberculosis. Event 2 is taking of medications for 6 months, or pwede rin yung cannot afford to buy the medicines because he is the breadwinner of a family. There is both biopsychosocial, and then number 3 is recovery. So ano yung pwede natin gawin dito? By group? Parang ganun lang, gagawa lang kayo ng ganito. Or individual. So event 1 would be, sa kanya, the event 1 would be yung diagnosis of pulmonary tuberculosis. Diba? So event 2 will be cannot buy this, no? So because he is the breadwinner of the family. And then event 3 is recovery phase. Anong suggestion ng body? Individual na lang, Better? Can you chat kung pwede, group or individual?
Group na Doc.
Okay. Sige, group na lang. Alam mo naman, democratic naman ako.
Thank you, Doc.
Sige. Okay, so we'll move to HIV/AIDS. Question so far. sa biopsych. Ganun lang yun. Simple pero mahirap gawin kasi it takes time. I think time is something that you really have to spend. You know, I've been a doctor for how many years? 20, pera ka years na ba? 22 years. No? 22 years. Proven and effective sa practice ko is I spend time with my patient. And because of that, maganda yung nagiging effect sa kanila ng karamihan yung mga pumupunta sa public health, usually psychosomatic. And ngayon, nag-change na, dumadami na yung non-communicable. Deadline is next week. Any questions so far before we move to HIV/AIDS? Yeah. Depende kung nasaan ka. I think kulang pa rin yung pag-educate. Kaya ihuli ko muna yung TB kasi iba na ngayon iba na yung management of ng TB ngayon. Yes, meron pa ring stigma. May stigma pa rin. Yeah, you can write it in the you can write it. Pero kasi farmer, di ba? Usually, ang pa niyan, kung breadwinner ka of 6, ang challenge niya is not stigma. Ang challenge niya is to sustain, no? Yung pag-medicine, pag-inom ng medicine. Or ang isa sa challenge ng pulmonary tuberculosis na malalagay nyo towards the second is how you are going sa community yon, how you are going to connect sa rural health unit or unit para mabigyan siya ng libreng medicine. Pero ngayon kasi yung TB, pag may TB ka, highly suspicious din yung HIV. Kayo ba, Tines? Tines ba kayo ng nagpa-test kayo ng tines ba ang mga first year sa HIV? Or HEPA B lang?
HEPA B lang.
You have test for
Bilang po.
HEPA B? HEPA B lang. Wala pa yung HIV.
Hindi ba, Doc, HIV
Hala
testing
ko,
is voluntary dapat?
Oo. Yeah, voluntary. Gusto mo mag-volunteer? Dr. Timbal? Oh, meron kami. If you want to have a HIV test,
Doc,
welcome.
I'm clean.
Doc? I'm sorry, I did not hear you. Ha? Actually, let me know kung gusto niyo magpa-test. It's free naman. Okay ka na, doktora? Yung nag-ask. Would you like to share before we continue? Mm. 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 Paano ka nag-cope up? Mm. Totoo. Yes, totoo 'yan. Lalo na ngayong COVID-19, marami kaming nagkakaroon ng anxiety because of the COVID-19. And, actually that's why tama talaga yung right education na, ah, for example yung yung TB nga, hindi naman nila alam yung kinuwento ko last week 'no, 'pag 1 week na lang ngayon, dati 2 weeks, 2 weeks of with hindi na nakakahawa yung TB. So hindi yun na-e-emphasize. Okay. So HIV and AIDS, there is hope. HIV is not AIDS, no? Although if you have AIDS, you are positive with HIV. Pwede ba na ang HIV ay hindi nagpo-progress sa AIDS? Yes or no?
Yes.
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 Kapag mag-start,
Pwede, no?
terminal
So that's another importante talaga na alam natin yung stages ng diseases, especially if it's chronic stage. Tapos yung tamang information, okay? According to the Department of Health, by in 8 years time, this is 2017, no? By 2025, there will be 201,000 people living with HIV. Okay? So it is increasing. It is increasing, and siguro you can just write in the chat box what are some of the reason why AIDS is now a global epidemic. No? Why is it keeps on increasing while I'm having, and you can just chat bakit ganon? Bakit increasing, no, from 16,000 on 2010, it is increasing at increasing rate, no? Pataas ng pataas. You can just write in the chat box. Okay. So, in 2014, no, AIDS epidemic update, people currently living with HIV is 36.9 million. Okay. Every 60 minutes, there is a new reported case, HIV case in the Philippines. Every 60 minutes, that's every hour, no? So, and out of the 36.9 million, 2.6 million are children, no? And most people who are infected do not know it. Yes or no?
Yes.
Yes,
Yes.
Doc.
Yes po.
Why? No? If you look at this, the latest is 2017. 80% of new infections will come from 70 high burden areas. So 26 in the National Capital Region, 48 areas in Mindanao and Visayas. Can you imagine? Tacloban kasama na siya sa high burden. Okay? Kasama ang Tacloban sa high burden areas of HIV and AIDS. Okay. So 8 out of 10 reported cases in the past 10 years were males who have sex with males. So MSM is still the highest, no, transmission of HIV. So either MSM, males who have sex with both males and females, male to female or female to male, sharing of used needles, or mother and child. Okay? So if you look at this, di ba nakikita mo yung color? From 1984 to 2006, the transmission, 62% is male to female or female to male sex. Ibig sabihin, heterogeneous. Pagdating ng 2007 to 2017, nag-change. It is already male-to-male sex. And also, bisexual. No? Males who have sex with both males and females. Lesser na lang, less than 1% na lang yung sharing of used needles. Okay? So, risky behavior start early, protective behavior starts late. Kaya nga ang problema kasi ganito. Sa Pilipinas, at 12 years old, 10% of 12 years old have their first sex. Okay. So the median age of first sex is 16 years old, and 17 years old is the first anal sex, and then 18 years old lang yung mag-first condom use. Okay? Even ito isa to kasi sa isa sa ang HIV AIDS sa passion ko na talaga if there's no risky behavior, there will be no HIV AIDS. Ako I am not so much on the condom use, pero ewan ko kasi kung bata ka na nagko-condom use, the problem is it's not really on the later kung ano yung reason bakit meron pa rin. In fact, sa Tacloban, meron kaming napaanak 13 years old. So, ibig sabihin, nag-start siya ng 12. Diba? So, without treatment, person living with HIV die 10 years after HIV infection. So, ganyan yung ano niya. Kaya dapat, importante na magpa-test, especially if you have risky behavior. 2 out of 3 new HIV infections are 15 to 24 years old. Okay. Ilan sa inyo ang between, hindi naman 15, ilan sa inyo ang 15 to 24 years old? Taas ang kamay. Ano ba yan? Heart na lang kasi bata pa 15 to 24. Ilan sa inyo ang 15 to 24 years old? Siyempre, below 20. Okay, very good. So, sexual promiscuity, lifestyle. Ang babata nyo pala. No? So, early sexual involvement, people not adhering to safe sex practices and they don't have themselves checked, especially if they have multiple partners. So, yes, Dr. Ann Cinco, you're raising your hand. Yes. You already raised already. So, mga bata pa talaga yung nandito. So, kayo yung tamang audience for HIV, no? 2 out of 3 new HIV infections are 15 to 24 years old. Okay. Is there hope? So we can halt the progression of risky behaviors by teaching our young people to make wise decisions. So some of the facts is that the immune system defends the body against infections and diseases. When HIV enters, more and more of the CD4, no? May CD3, but sa HIV, CD4 cells are killed. The body becomes less and less able to fight off the many different germs which attacks our body all the time. And we call it opportunistic infection. Like pneumocystis carinii for pneumonia, candida sa fungal, no? Maraming mga opportunistic infections. Okay? So, now we call it AIDS when the immune system have been compromised and damaged. Many germs cause deadly diseases, and this is the stage called AIDS. So, questions. What happens when a person is infected with HIV? Okay? There are 4 stages. The first one is primary infection, stage 1. The virus attacks CD4 cell and rapidly starts to multiply using the body's white blood cell. This is a window period 3 to 6 months. Remember, yung sinabi ko, there's a window period. There is asymptomatic carrier. No? Stage 2, asymptomatic, no signs of illness. Stage 3, symptomatic. There is minor signs of illnesses. Cough for 1 month. Itchy skin. Cold sores all over the body. Hindi bossy, all over the body. Shingles. Oral thrush in the mouth or throat. Ito, nakita ko tong mga symptomatic stage pag nandun ako sa jail. I do a drug dependency evaluation. Talaga, siguro sa jail, we have already three HIV positive. Hello?
Hello, good afternoon. Kapatid ako ni Raul assistant kapitan sa barangay 72.
Kayo po yung gustong umuwi?
Yung kapatid ko kami,
Apo.
kung nandito kami ngayon sa nag-stranded kami sa Vancouver.
Yeah.
Dahil yung
Ma'am, I am in meron po akong klase ngayon. Can you just call a little later? Apo. I have a class. Okay.
anong oras po?
After kasi after this I have another class eh. So natatapos po ako between 5 p.m. Yeah. Nagkausap na kami ni Kapitan.
Oo. Anong oras niyo ngayon? Kasi dito sa amin, it's 10:17 in the evening.
Nako, medyo bukas na lang po kayo tumawag kasi by the time I'm finished, it's already late. Yeah.
Oo. Okay lang. Kasi anong oras ngayon dyan para malaman ko?
It's 2:17 p.m. po.
2:17 p.m.
Yeah, I will be done by 5 o'clock pa po.
5 o'clock. Okay lang.
Sige po, okay.
Right. Thank you.
You're welcome.
Okay, bye.
That call I cannot deny kasi it's from Vancouver. So, yun sa mga prison cell, meron tayong mga positive for HIV and it's very yung isa doon is a DJ, no? Nahuli siya DJ and then guwapo nare-remember ko siya, sabi ko parang pero hindi ko lang ma-remember kung saan ko siya nakita. Tapos he went to Cebu, ano ba tawag dito? From DJ call center. There he had MSM. So ngayon nandun siya sa stage 3. Actually nag-stage 4 na nga siya pero naagapan nagkaroon ng medicine. So immune system is destroyed pag stage 4. It's a full-blown AIDS, weight loss. Pumayat siya. Grabe. Yung kanyang katawan, makikita mo dati, ang ganda-ganda. And more than 10%, there is weight loss, more than 10%, diarrhea, and pneumonia. Okay. So, question, how can I tell whether I am HIV or positive or not? Of course, you can know only if you are infected by HIV. Yes, if you go for an HIV test. So, people are very often afraid of knowing that they are HIV infected. Stigma contributed in driving the epidemic underground. So early diagnosis and treatment will help save more lives. So that's why with these 121 students, I am welcoming you if you want to be tested. And it's confidential. Okay. So if people are infected with, ito yung mga karamihang question, ito yung hindi ko na iaano yung pathophysiology, but these are the most, if people are infected with HIV, how long before they get AIDS? Kanina sabi natin, di ba, 10 years. On the average, people infected with HIV develops AIDS after 8 to 10 years if they have received no treatment. But with treatment, they can live even for 70 siguro. The use of antiretroviral drugs correctly and can tolerate possible side effects, they can survive many years longer. So, how does a person become infected with HIV? Of course, the conditions of HIV survival, the body fluids, the risk increasing condition. Okay. Ito yung tatlong importante. Okay. So, first is condition of survival of HIV. HIV is a virus that cannot survive outside the body at all. Kaya, sabi nila, yung paggamit mo ng CR na hindi mo yun makukuha doon. Although, kung ang problema lang doon, kung nandun yung papasok ba yun, no? They need an inside a human body. Conditions are perfect for the virus to survive and multiply. Okay? Kasi kailangan nila yung human temperature, of course, kailangan din nila moist, no? Kailangan moist. Okay? So, the human body temperature is ideal for the virus to survive. And the body is moist inside. If there is the virus should not have contact with air. Okay? The neutral pH virus needs a pH balance very, very close to those who find within the human body. And there must be a point of entry. Kung walang point of entry, remember the chain of infection, kailangan may entry. Kaya nga it's either anal sex, oral sex, or even yung madami, no? Yung yung inject needles. So, hindi magsusurvive yung virus outside the human body. So, these are the body fluids that are high in concentrations. Blood, vaginal fluid, seminal fluid or semen, and breast milk. Okay? So, sa breastfeeding talaga yung pinaka-high. Halimbawa, buntis, HIV positive siya. Transmission is on the breast milk rather than on the placenta. Their body fluid is that their tears, perspiration, and urine. Because of this, pwede bang happen ang may HIV? Yes or no?
Yes po.
Yes. Oo, pwede nating yakapin, ha? Okay. So, the most common methods of transmission of HIV are unprotected sex with an infected partner, sharing needles with infected person, and right now, almost eliminated as risk factors for HIV transmission are infection from blood products. Alam ito ng mga medtech kasi tinetest talaga. And then transmission from infected mother to fetus. So, what can you do to protect yourself from HIV infection? Of course, abstinence is the best way to protect yourself against HIV infection. The longer young people can wait before they have sex, the less their chances of becoming HIV positive. Sex is God's gift for married couples as designed by God. Pero kung hindi na talaga kaya abstinence, dapat protected. So, AM, FM yung aming advocacy. AM is abstinence before marriage. FM is faithfulness while married. So mutual faithfulness between married couples is the best way of protecting yourself against HIV and other sexually transmitted infections. Of course, do not use drugs, especially inject, and do not share needles to avoid HIV infection. Ito yung nangyari sa Cebu, no? Meron dati sa Cebu, inilalabas mo na lang yung arm mo, tapos i-inject nila doon yung kaya taas ng HIV infection sa Cebu. Pero ito na nga, nangyari yung COVID-19. Hopefully, 2020, bumaba yung case of HIV kasi wala namang source. Okay? Anybody can get infected with HIV, but nobody has to get infected. In most cases, HIV is 100% preventable. So, prevention strategies, safe practices, access to treatment, voluntary testing, and empowerment. Siguro ganun din sa TB and other highly infectious, safe practices, no? Health protocol, access to treatment if there is, voluntary testing, and empowerment. Very important is the empowerment of person para walang masyadong stigma. Can AIDS be cured? At this stage, there is no cure for HIV infection. ARB can only slow down or delay the HIV destruction of body's immune system. But until now, there is no cure. Remember, the only effective way to prevent HIV infection is to prevent any contact with the virus. And that depends greatly on you and your lifestyle. Okay? You can PM me you can PM me if you want to be tested. We can arrange that. I think it's every Friday. No? So, of course, ang isa sa i-change is the common misconceptions. Okay? Like HIV cannot enter the body through coughing, flies and mosquito. Unless, of course, yung TB ha. Flies and mosquito, massage, breathing, sport, sharing food or clothes, or even toilet seats. Ha? Kasi dapat may opening. Pag nasa labas na yan ng body, mamamatay na yung virus. Kaya dati yung sa sa dati 'di ba? Oh, kailangan ilibing agad. Ngayon hindi na. Pwede nang lamayan yung HIV positive. Okay? Unless nga may TB. HIV cannot enter the body through swimming, dancing, living, and bathing together, kissing and touching. Pero, eto yung kissing, hindi yung torrid kissing na to. Kasi pag torrid kissing, diretso na yan sa, yung ano lang, yung ganyan-ganyan lang. Sneezing, holding hands, and hugging. There are no known cases of people becoming infected with HIV through normal living with an infected person. So parents and healthcare workers who look after people with AIDS do not become infected as long as they are not accidentally injected with infected blood, okay, or secretions. So your choice has consequences, but the consequences of your choice you cannot choose.
The question,
Okay. Supa po.
di
Yeah.
ba, Doc, HIV virus is aerophobic? So, mga how many milliseconds or seconds would it take for the virus to die outside the human body when exposed to air?
Wala na siya, patay na talaga yun.
Like
Oo.
immediately,
Pag talagang wala sa body.
like immediately, like after pag-inject tapos yung ano ba, yung needle right there, and then paglabas ng needle sa body ng infected person, mamamatay ba agad yung virus? Doc? Doc, sorry na, Doc. Char.
Na-stress adahidok ko.
Di kang kupay, Google ko na la.
Di ba may dadto kuan like 2 minutes mamamatayan virus sa surface kung bubutanganin kuan mga Zonrox scheme.
With solution, pero unnatural exposure laba to air. Amo to na kung gusto mo sabdan unta. Mamuji, sorry na, din ako galit.
I-end ko na lang po it meeting.
Paalam na daw.
Bye.
Bye.